another organization that is hitting some important milestones is the National Public Cord Blood Bank. And now I'll ask Dr. Elmo asked me to tell us what's going on with the blood bank, with the cord blood bank.
Thank you very much for that introduction and for having me here today. So I just have a few short slides. I want to keep this really informal, so please feel free to stop me at any time and ask me any questions that you might have. A big question I often get asked is, what is cord blood and what are the type of cells that you're talking about? And we're actually specifically talking about hematopoietic stem cells or blood-forming stem cells. So oftentimes, I think when people hear stem cells, they think, oh, you're taking cells from aborted fetuses, and that's not what we're talking about here. These are specifically blood-forming stem cells. So these are the cells that give rise to the cells that we find in the bloodstream. So either red cells for carrying oxygen, or white cells for fighting infection, or platelets, obviously, which are involved in blood clotting. So how are these type of blood-forming stem cells collected? There's really two ways. You've probably often heard of an adult donor. So I work at Canadian Blood Services. We do have an adult donor registry, the One Match Stem Cell and Marrow Network. So with our One Match registry, any adult donor between the ages of 17 to 35 can join the registry. And stem cells from potential donors can get collected in one of two ways. The most common way people know of is a bone marrow aspiration. So that's what they would go in through large bones like in your pelvis or your hip bones and take out your cells from the bone marrow. The second way is you can be hooked up to a machine, like in the picture, and it's really done through apheresis stem cell collection. So they just take out the stem cells and your blood gets returned back to you, all the other components that they don't use. And obviously the third way that you can get these cells is through cord blood. So cord blood is the blood that remains in the umbilical cord and the placenta after a baby gets delivered.
I have a question.
Sure.
Why do you only take the stem cells up to age 35?
So that's
People
a
age 36 useless?
No, no, and most of us on this panel would probably be useless, so that's not the reason actually. So when somebody gets a stem cell transplant, they actually find that patients do better when they get cells, A, from male donors, so really try to get cells from male donors, and B, from younger donors. They tend to do better. So it's really for the benefit of the patient for us to build a registry between that age of 17 to 35.
And do you know why the male ones would be better?
There is some work to think that, especially women after they give birth, that might change the immune response. So I think that's why they really want to build a registry of young males. So that's why we do have a cutoff of 17 to 35. And this is not unique to Canada. You see this in other parts of the world as well.
Thank you.
No problem. So what can these cells then be used for? And the most common things are things like leukemia, lymphoma, blood cancers, aplastic anemia. But as well, they can be used for things like sickle cell disease as well as other inherited immune disease. And right now, stem cells are being used to treat over 80 diseases and disorders. And that list actually keeps on growing. When I started at Canadian Blood Services about 4 years ago, I think the list was at 50. And in that short period of time, that list has grown to about 80. So why do we actually even need unrelated donors? So if somebody gets diagnosed with a disease where they would need a stem cell transplant, the first place they would usually look is within a person's own family to see if somebody is a potential match. And about 25% of patients are fortunate enough to find a match within their own family. But for those other 75% of patients who don't find a match, they're really reliant on an unrelated donor. So these unrelated donors could either be an adult donor who's joined the registry or from cord blood. The thing that always gets to me is that about half of our Canadian patients actually can't find a match. And the reason for that is that when you talk about stem cell matching, you're really matching to genetics. And here in Canada, we have a lot of unique ethnic groups and populations that you don't find in other parts of the world, such as our Aboriginal, Métis, Inuit populations. And we have a lot of mixed race patients here in Canada as well. And that makes it a little bit more challenging to find a match. So even though there's about 27 million people around the world who've signed up to donor registries, like our One Match registry, and over 684,000 publicly banked cord blood units, like I said, we still can't find matches for about half of our Canadian patients. So why would we want to sometimes use cord blood over an adult donor? And cord blood has some distinct advantages over using peripheral blood or apheresis blood. And probably the main reason is with cord blood, you don't need such a perfect genetic match. So usually when they're matching for an adult donor, they're talking about a perfect 9 out of 10, you might have heard the term HLA or human leukocyte antigen, so these are genetic markers. So with an adult donor, you would usually need a 9 out of 10 or a 10 out of 10 perfect match, but with cord blood, you can get away with less strict matching, so they usually match out of 6. So you can get away with as low as a 4 out of 6 match. So for our hard-to-match patients, cord blood is often the stem cell source that can be used. The other advantage is because these cells are collected and banked, we have them frozen in liquid nitrogen, we can get them out the door quite quickly. As opposed to an adult donor who might have signed up to a registry 5 years ago, then you have to track the donor down, find them, they have to have their infectious disease markers retested. But with cord blood, we can get it out to a patient quite quickly. There's also a lower risk of a disease known as graft versus host disease, so this is a complication that can occur if somebody receives a transplant. And really, this is a product that for a very long time was getting discarded as medical waste. And really, there's no risk to the patient, to the mother, or the baby, because all aspects of the collection happen after the healthy delivery of the baby. So our objective really in Canada was to build a national public cord blood bank that really reflects the unique ethnic diversity that we do see here in Canada to really help more patients be able to get a transplant here in Canada as well as around the world. So like I said, we have a really, people are much more likely to find a match within somebody of their own ethnic group, and that's why it was really important to try to build a bank that, like I said, reflects the diversity that we see here in Canada. So really the goal of the bank was to offset our one-match registry. So we collect now, our program is national, and we collect in 4 cities across Canada. So we are here in Ottawa, in Brampton, in Edmonton, and as well as in Vancouver. So here in Ottawa, we do collect at the Ottawa General and Civic campus. So any mothers who are delivering there, we encourage them to consider signing up to donate their baby's cord blood. So I just thought I'd give you this profile. So this actually just shows you what is the ethnic population of our Canadian patients who are looking for a stem cell transplant. And you can see about 62% of them are Caucasian and 38% are non-Caucasian. And you can see the breakdown of the different ethnicities there. I just thought I'd show you in contrast, our one-match adult registry tends to be about 70% Caucasian. So it's overly represented by our Caucasian donors. So we're trying to really offset this. So right now, we have just over 1,100 units that are currently listed for transplant purposes to our Canadian and international transplant physician. And you can see our ethnic diversity right now is about 46% Caucasian and 54% ethnically diverse. So this is really, we're trying to build a bank, like I said, that targets those unique ethnic groups that we do see here in Canada and close the gap with what we're finding on the registry. We also do have a cord blood for research program. So moms here in Ottawa have the option to donate their baby's cord blood in the event that it's not bankable to go to research. And right now, like I said, there's lots of research studies going on around the world to use cord blood for other applications. Some of them are listed there, everything from autism to cerebral palsy to baldness to aging. So there's lots of work going on. Baldness.
I'm in.
So there's lots of potential use of cord blood in the future. And right now we've distributed actually over 200 units for research purposes to scientists across Canada. I just thought I'd add this as one of my last slides. So mothers who are donating often hear about public and private banks. So I've been talking about Canadian Blood Services public banks. So oftentimes mothers do hear about both options. And the primary difference is when you're donating to a public bank like a Canadian Blood Service, there is no cost to doing this, and your donation goes to anybody who needs it in Canada or around the world. So you don't earmark it for somebody in your family, as opposed to with a private cord blood bank, there is a cost to it. It's usually anywhere between $1,000 and $3,000 initially, and then there's usually $100 to $200 or $300 annual storage fee to keep that unit frozen. But the difference is that unit then belongs to just you and your family, and nobody else has access to it.
I have a question.
Yes?
What's the difference between the blood from the cord and the actual umbilical cord? Because sometimes we hear that you can also freeze the umbilical cord itself.
That's a really good question. So sometimes you'll hear of people freezing cord tissue.
Yeah.
So that's actually where they take pieces of the umbilical cord and either chop it up or freeze it as a whole, and they extract things like mesenchymal stem cells, which I think Dr. Thibault is probably going to talk about in a little bit. So you can get these other kind of cells out of the weird, but majority of cells that we're talking about for these applications is primarily, like I said, hematopoietic stem cells in the blood itself. So we don't do any banking of the tissue right now, we just collect the blood.
But there's something you can use in this tissue also.
That's correct.
Okay.
Yeah, that's correct.
Question. Can the same umbilical cord be used by multiple children, for example, if they need it, or if we donate, like once it's used, it's over for one child?
That's a great question. So when somebody gets a stem cell transplant, I often think of it like a dosage of medication. They try to figure out how much does the patient weigh, and they give them a certain number of stem cells per kilogram. So in 1 unit of cord blood that gets donated, it usually has enough cells for a child or a smaller adult. But a larger adult actually would probably need 2 cord blood units for a transplant. So 1 unit goes to 1 patient, and adults would sometimes need 2 cord blood units.
What are some of the challenges with the raising awareness? Is this not how is this not 100% of the time collecting the blood?
Yes, I agree. And honestly, it's quite an easy sell to moms once they know about it, because like I said, unless they've made other arrangements, it would otherwise get discarded. And so I think we're just finding the biggest piece is just letting people know about it. So that's why these type of discussions are so great, because you tell a friend and they tell a friend, and we really want it to be that everybody just knows about public cord blood banking like we know about recycling. So.
But the other question is, why is it not available in every hospital? Because when I gave birth, I wanted to give the blood, but
Yeah.
it wasn't a possibility in the hospital where I gave birth.
Yeah, and the reason for that is, as I'm sure you can appreciate, we have limited dollars, and so we really tried to figure out the way, how can we make this resource, do the most with the money that we do have. And I think it's important to remember that we're building a bank that anybody who needs it would have access to it. And so that's why we purposely chose cities that were quite ethnically diverse, obviously like Ottawa, Toronto, Edmonton, and Vancouver. And we purposely partnered with hospitals with large birthing centers. So all of the hospitals that we partnered with have at least 4,000 births. They have a minimum at least 20% ethnic diversity. So we were strategic in where we picked to best serve patients who need the stem cells.
Just to talk to you about that. So I'm 32 weeks pregnant, and my doctor never spoke to me about that.
Wow.
So I saw a poster, a flyer on his office, and then I did the research myself.
Wow.
And I'm gonna be giving birth in 8 weeks, and if I haven't done the research by myself, I wouldn't know about that. And I have my first baby, which is in a private blood court, and he knows about that because he had to sign the papers about that, but he never approached me to talk about the public one.
Wow.
Can I ask you where you're delivering?
At the general hospital.
General.
So I filled in the papers, everything is signed.
That's great.
Are there more barriers with the ethnical culture, the different cultures about giving the blood or giving?
That's a really good question. So when I first started, we did a lot of work with some of our Aboriginal populations, such as our First Nation, Inuit, Métis groups, because they do have cultural practices sometimes where, for example, they bury the placenta after the birth. But we do tell them if they do want the placenta back, we can return it back to them. So I think a lot of it is just educating people and making people aware and talking to them about what is possible. So.
Okay, what do you think about blade clamping of the placenta?
That's a good question. So delayed cord clamping is something that people might have heard in the news. So delayed cord clamping is when basically they wait to clamp the umbilical cord. So usually the physician might wait anywhere from 30 seconds to a couple of minutes. And delayed cord clamping has actually been found to be beneficial for preterm babies. And the term delayed actually varies between different sites. So a hospital might say delayed means 30 seconds, and another hospital say delayed might mean 2 minutes. So every hospital has its own policies and procedures around what delayed cord clamping is. We at Canadian Blood Services don't interfere with whatever the hospital policy is for that. But obviously, the longer the delay, the less blood that remains in the umbilical cord, so the less blood we would get for a donation.
Sorry, but what would you see the benefits in delayed cord clamping?
The benefits to
The child.
So there are benefits, like I said, for preterm babies. There actually haven't, to my knowledge, been shown any additional benefits beyond the recommend. I believe the Society of Obstetrics and Gynecology recommends a minimum of 30 seconds, and all the hospitals that we partner with do that. But I don't think they've actually shown any additional benefit for full-term babies, to my knowledge.
That's great.
Thank you.